A prednisone warrior was wondering, was it COVID or was it something else? Was it prednisone withdrawal? That's what I'm going to talk about today. COVID versus prednisone withdrawal. I'm Dr. Megan, your prednisone pharmacist, and I've received phone calls from many people wondering how to tell the difference. So I'll tell you the story of one lady. She lives in Brooklyn, New York. Her family was in the epicenter of the worst outbreak in the United States back in the spring of 2020, New York City. And they took matters into their own hands. They went on lockdown. They kept themselves as completely isolated as possible because she knew that she had a high risk for complications because she had an autoimmune disorder and was taking prednisone. Well, eventually she slowly got off the prednisone and she had zero contacts. They even had their groceries delivered and they would wipe them down. Like there was no way she could get COVID. So then one day, after she'd slowly gotten off the prednisone, she was so surprised to find that she had a fever, she had aches and pains and misery. And at that time, there weren't enough tests for COVID. She couldn't find out whether she had it or not. So the doctor said, just assume it's COVID. And she went on to try to heal. And for some reason, it wouldn't go away. She tried everything and the COVID would not leave. She went to one specialist and they diagnosed her with rheumatoid arthritis. She went to another doctor and they diagnosed her with myositis. And all of these different specialists were trying to pinpoint to exactly what this bizarre, strange diagnosis was. Because this COVID that was supposedly way back in April for her was still persisting through June. She had no idea why she was having all of these symptoms. Well, the timing is the clue here. She went off the prednisone and then started experiencing these things. It wasn't because she had COVID. She didn't get COVID. It was actually prednisone withdrawal syndrome. It was actually symptoms of adrenal insufficiency, not COVID. So how do you tell the difference? If that's a potential problem, if you are taking prednisone and you're wondering, is it COVID or is it prednisone withdrawal? How can you tell the difference? And when do you even feel prednisone withdrawal? So you can feel prednisone withdrawal anytime when you're decreasing doses. If you're going from a way high dose down to a lower dose, or from a low dose to zero, or from any dose to zero, you can feel these symptoms. And what are they? So the symptoms of prednisone withdrawal, I'm going to read it directly from this study. This is the steroid withdrawal syndrome with a review of the implications, etiology, and treatments. So on here it says that prednisone withdrawal syndrome or steroid withdrawal syndrome, they're the same thing because prednisone is a steroid, is an objective syndrome resembling true adrenal insufficiency and characterized by fever, anorexia, that means you don't want to eat anything, nausea, lethargy, that means you're really tired, malaise, you just feel yuck, arthralgias, that's joint pain, like when your shoulders, your back, your neck is achy when you're sick. Desquamation of the skin. That means your skin's peeling. Maybe your face or your hands or your feet. Weakness and weight loss occurring with highly variable grading in patients undergoing steroid withdrawal. Other symptoms include abdominal pain, vomiting, postural hypotension, hyponatremia, and hyperkalemia. So those are all some really fancy scientific words, but basically the important ones to know are that a lot of those sounded a lot like COVID symptoms, didn't they? I made a little overlap, a little Venn diagram, and I can send you a copy of that if you want. Let me know below and I can send it to you. This Venn diagram shows the symptoms of prednisone withdrawal symptoms of COVID and where they overlap. So first I'm going to talk about where they overlap. First of all, nausea. You can get nausea with both COVID and prednisone withdrawal. Emesis, that's when you're throwing up, vomiting. Both of them can have that. Lethargy, fatigue, weakness, reduced strength. That can happen in both of them. Headache. And when it talks about prednisone withdrawal headache, they said a diffuse headache, that means it's like everywhere, was found in half of the patients, and sometimes the most distressing symptom, often lasting for many days. That's what it feels like for those people who get a headache in prednisone withdrawal. It's extremely distressing and lasts. There's like nothing that makes it go away. Okay, fever. I think we're at 5. Yeah, fever. Isn't that crazy that just going off of prednisone can cause a fever? Like, doesn't that seem like it should be the one thing that would be like, oh, that's an infection? Nope. Arthralgia, myalgia. So arthralgia means joint pain. Myalgia means muscle pain. Moderate anorexia. So that means loss of appetite. And those 7, nausea, vomiting, fatigue, headache, fever, chills, muscle aches, body aches. Those 7 are from the CDC website and that article. Those are the ones that overlap. Then we have some that don't overlap. So some symptoms of COVID, we'll go to the COVID ones last. Now we're going to talk about the symptoms of prednisone withdrawal / steroid withdrawal, whatever you want to call it, that don't overlap. So these are possible with COVID, but they're not listed on the CDC website. So they're rare things with COVID. Weight loss, desquamation of the skin, arthritis, bursitis, postural hypotension, and abdominal pain, and hyperkalemia. So those are the things, hypoglycemia and sleep disturbances. Those are all the things that prednisone withdrawal or steroid withdrawal syndrome have that COVID does not. Now for the things that COVID causes and prednisone does not. They include, and the most important one to me, is cough. You don't get a cough when you go off of prednisone, unless you've been taking prednisone for a cough and your cough is coming back. But if you are getting a cough after going off prednisone and you weren't taking it for a cough or a breathing issue, then that's not at all a likely possibility. Shortness of breath or difficulty breathing, and that's the same thing. If you're taking prednisone for asthma or COPD, then your symptoms could be coming back, and that's why you're having that. This is totally impossible with prednisone, is new loss of taste or smell. I've never heard of that. I've heard of weird tastes, like a metallic taste with prednisone, but I've never heard of new loss of taste or smell. Sore throat. People don't get that with prednisone. That's COVID. And then a few more things include congestion or runny nose. We don't get that with prednisone. That's only COVID. So cough, shortness of breath, new loss of taste or smell, sore throat, and congestion or runny nose. Those are the 5 things that only COVID causes and not prednisone. So that is how you can tell if it's prednisone or COVID. Those are the important things. What about the flu? How do you tell if it's the flu? Because the flu overlaps too. So I found a study and I thought it was so fascinating. They did a comparison using really fancy statistics of which symptoms are caused by which virus, whether it's COVID or flu. So you could tell the difference between those. And they really cool modeling of how to tell the difference. And so what they were looking for was the first symptom that somebody experiences. And they had to be something that the person would feel, that it was like an objective thing that you can actually say, yes, I have this, or no, I don't have this, instead of just a yucky feeling or a fatigue feeling. You can't really say, oh, that started that exact moment. Those are really hard to define. So they could only use ones with precise definitions. So the ones they were looking at, you can say, this is what you look for first. So with COVID, the thing you are most likely to experience first is a fever, and then a cough, and then nausea and vomiting, and then diarrhea. So that's the order for COVID. And then for flu, you reverse the first two. You're more likely to have a cough first with the influenza virus, then fever, then nausea, vomiting, and then diarrhea. And what was really interesting about that is that diarrhea is the last symptom on there. So they think it's probably because the virus enters somewhere in your nose. And that's why it's so important, if you're wearing a mask, to cover your nose. You need everybody around you to be covering their noses because it replicates in your nose. So if you sneeze, if you're breathing out your nose, it can let those virus particles out. So the virus replicates in your nose, and then it goes down your GI tract. And so it would be nausea and vomiting first, and then farther down you would get the diarrhea as the virus progresses through your gastrointestinal system. So I'm going to review that one more time. COVID gets a fever first and then a cough, and then the GI things. Whereas the flu gets the cough and then fever and then GI things. So that's how you can tell the difference between flu and COVID, and steroid withdrawal syndrome and / prednisone withdrawal syndrome, whatever you want to call it, and COVID. I have this little summary I can send you if you let me know below. And then I have a whole bunch of other posts on my website. I'd love you to read and let me know what other questions you have about prednisone and COVID. Signing off as Dr. Megan, your prednisone pharmacist.